Hey guys, what's our today's plan for the previous year question paper discussion?
In our previous discussion, we have completed 6 5-mark questions. Today we are going to discuss rest of the 5-mark questions on 2014 August previous question paper.
Okay, the next question is pulleys and springs.
Pulley is the grooved wheel, which moves around an axis, and the rope or the iron cable passing through the groove. 2 categories of pulley are seen as under: fixed pulley and movable pulley. In fixed pulley, the pulley is attached to the fixed point. The fixed pulley is acting as the first order lever. The weight, R, on one side and the effort, E, on another side with the fixed axis is fulcrum, F, in middle. This type of pulley is used to alter the direction of the force by which the resistance or the traction can be applied to the body parts. Example: lateral malleolus acts as the pulley for the peroneus longa tendon to reduce the resistance force of that muscle.
In movable pulley, one end of the rope is attached to the fixed point and another end is passed through the fixed pulley. The movable pulley is attached in between the fixed point and the fixed pulley. The movable pulley acts like the second-order lever. Generally, second-order lever will have the mechanical advantage. This movable pulley reduces the restricted force into half. There is no second-order lever seen in the human body. This type of pulley used in the suspension therapy units, which makes easy to lift the body parts. This reduces the restricted force to half and easy lifting the body parts.
Springs are used to assist or resist the movement in exercise therapy. Sometimes it is used for the passive mechanical stretching of the soft tissues. One end of the spring is attached in the beam, another end is elongated by the force. Sometimes the springs are graded in the weights. Example: 20 Ibs, 40 Ibs, 50 Ibs, 75 Ibs.
Okay, the last 5-mark question is percussion manipulation. Percussion is a manual technique used by respiratory physiotherapists to improve airway clearance by mobilizing secretions in one or more lung segments to the central airways. Percussion over an affected area produces an energy wave, which is transmitted to the lungs and airways. It is performed with the aim of loosening thick, sticky or retained secretions from the chest wall. Chest percussion can also be used in combination with active cycle breathing techniques or coupled with positioning in those who are unable to actively participate in active controlled breathing exercises. Combining this technique with postural drainage is very effective and can improve the drainage process in patients with abnormalities in cilia that inhibit effective airway clearance. Percussion can be performed in 2 ways: manual percussion and mechanical percussion. Percussion is often a beneficial manual technique to help in the removal of secretions in a number of respiratory conditions. These include cystic fibrosis, emphysema, chronic bronchitis, pneumonia, adult respiratory distress syndrome, ARDS, bronchiectasis, chronic obstructive pulmonary disease, COPD.
Technique and treatment with percussion. Chest percussion is performed with cupped hands by trapping air between the patient's thorax and caregiver's hand in an alternating rhythmic manner over the lung segments in which the secretions are to be drained. This loosens the thick, sticky secretions from the walls of the lung, allowing them to move more freely into the larger airways, especially when used with associated gravity positioning. It is performed during both phases of breathing, the inspiratory and the expiratory phase. Position the hand in cup. It is must that the position should be maintained this way till the end of the treatment. The sound heard must be hollow and not of a slap. If erythema occurs, it is result of slapping or not trapping enough air between the hands and the chest wall. Rate of percussion, 100 to 480 times. The force applied must be equal. The rate should be slowed down if the force of non-dominant and dominant hand doesn't match. Hand position should be such that the percussion is avoided on bony prominence like spine of scapula, clavicle, spinous processes of vertebrae. Percussion must be avoided on floating ribs as they have single attachment. Patient may be taught to self-percuss with one hand over the areas which are reachable.
Guys, we have completed all 5-mark questions. Tomorrow we will discuss the 2-mark questions. See you guys.